available. The city has been up and available since beginning of May, end of April. So we're still working with currently Peoria Heights, West Peoria, and Chillicothe to get their information up. Landfill committee did meet in December and will meet again in April. They did discuss budget, and I have some of those finalized numbers that I can bring next month. But I don't have the minutes yet to say that it was finalized for sure. Moving on to sustainability update. Last time we met, we discussed the updated sustainability plan, keeping in mind it was first adopted in 2011. We've done 5-year updates. The most recent update was an expansion that included a few more energy metrics, or energy focus, I should say. And so the team has been meeting the last couple months and have what we feel is nearly a final draft in the packet. We have three public meetings over 2 days next week. On March 2nd, we're hosting a public meeting just for education and to answer any questions the public may have. March 2nd at the North Branch Library at 5:30, and March 3rd at HHS. We're hosting 2 meetings, both at 10 a.m. and 5 p.m. This sustainability plan is it is the 5-year update, but it also is in coordination with the Energy Efficiency Conservation Block Grant that paid for that building assessment that you saw finalized in July of last year that Melissa Woods brought forward. This is the final deliverable from it, is that we would update our sustainability plan to include more energy focus. We retained the same areas of the plan that were originally adopted in 2011. However, we expanded out the metrics, the responsible parties for each of those. So you'll see a table following each of the plan elements. There is expected to be progress, either the amount outlined in the plan, the percent reduction, or to meet some SMART goals there, or if there is no specific reduction or metric that we're following back to, we expect to see progress in that by 2030, our next update. So that's the way we wrote it. Some of them were a little bit harder to measure than others, as you might imagine. Utility tracking is easy. And we have started with GIS. We have a proof of concept dashboard already designed, and we're tweaking that a little bit. And I hope to bring that next month to show you. That'll be hosted on the website so that the energy usage for any of the buildings is available to the public to take a look at, to ask questions. And then, of course, in addition to that, finally being able to utilize story maps to explain some of the changes in energy use, et cetera, over each building as we do either improvements or the difference in moving to HHS and combining all the different operations. And the coroner's space is different than it was previously. We now have, there's now freezer, expanded refrigeration, those types of things. So what does that look like, and why are you seeing the difference in numbers? So we're looking forward to being able to use story maps and GIS to be able to do that as well. So I'm open to any questions you have about that, about the plan via email or now. And then I plan to bring the finalized plan. That's a lot of planning. I'm going to bring the finalized plan to you next month, looking for approval. So any questions?
So are there any questions? We'll be voting next month on this, assuming there's not major drama related to it. Are there any questions for Becca on this? Ms. Allison.
Not a question. I did just want to say that within the last month, I've had 2 individuals from within the community come forward in regards to both disposal and recycling, with full of compliments for your office. So I don't know in what realm they engaged, but thank you for all the work you're doing for the county. Thank you.
I have to share, it's been fun on social media when people are like, how do I recycle this? And I'm like, there's this thing called Recycle Coach, and it's been fantastic to have that resource. Becca did show Rob and I the dashboard, and it's really nice, and I think it's going to be great when it's finalized. Any other questions? Please read through the plan and make sure to get any comments back to her and her department.
Thank you.
Thank you very much. And now Center for Prevention of Abuse.
Good afternoon, everyone. The final quarter of 2025 was perhaps in most ways our most productive as part of our partnership with the county. Our metrics were up across the board, and our people did a lot of tremendous work during that last quarter. I always bring along a few short snippet stories to tell you about what we do. The last couple of months, they've been about some real deep problems. We handle all kinds of abuse and neglect cases, some of the most egregious things that can happen to our clients. But I thought this month I would share some things that maybe are not quite so heavy hitting, but are yet every bit as much important. In our partnership, having an extra ombudsman allows most of the Peoria County facilities to have an extra set of eyes and ears that correlates to several extra visits by one of our staff members each month. For instance, we had one of our people that went into a skilled nursing facility. That's what most people would call a nursing home, and talked to a resident who was having an issue with her wheelchair. I don't know if any of you have ever had to be in a wheelchair for any length of time, but it's very discouraging. I have multiple sclerosis, and sometimes I have to use a chair, and it's very frustrating. And this resident was experiencing pain every time she sat in the chair with her right arm, and the facility had looked over her chair and categorically stated it was just because she's getting older, there's nothing wrong with her chair. Well, our person looked this chair over, and guess what? The armrest was installed backwards on the chair. And she had been living with this for a number of months. And we always have to get permission from the resident to advocate for them if they're able. And of course, that permission was given. And lo and behold, that very day, the administrator of the facility herself came down and fixed that chair for that lady. It's just simple things like that that make the lives of our residents much easier. We had a routine visit to a skilled facility, and our person went in to visit with the resident, and the resident complained that he had 2 pairs of shorts that were damaged in the laundry and came back with burn holes and tears. And the facility refused to replace the items. And after receiving permission from the resident, our ombudsman spoke with the administrator and reminded her that the facility is responsible for replacing lost, stolen, or damaged items. Many of you may not be aware of that. If you have loved ones in a facility, particularly a nursing home, they are responsible for replacing those items. And they'll usually tell the resident they're not. Well, that's where we're happy to step in and advocate vigorously. And guess what? The facility ultimately replaced those items for this gentleman. We had a resident of an assisted living that complained that his rent has been late 3 months, and each month it resulted in a $285 late charge after fees. That adds up quickly. And the resident knew that there was money in his account. He had a guardian with the Illinois State Guardian's Office, and our ombudsman spoke with the guardian and found out that the late payments were due to practices within the guardian's office that we were able to help resolve. And guess what? Not only is the resident's rent being paid on time, but we were able to get all of those late fees reinstated for that resident. So that's almost another $900 that the resident was able to receive. Uh, just a couple more I want to share quickly, and I'll be done. We had a resident that complained that he felt like he could live in a less restrictive environment. He had been in a nursing home because of a catastrophic illness, but was now doing better. So our people were able to coordinate with social services, and it took several months of advocacy and coordination. But this resident was ultimately accepted into a supportive living facility, and it offered the resident a private apartment with a little kitchenette, a lot of freedom and autonomy, and he's now able to go in and out of the community as he wants when he wants. And that was a real victory for someone who'd been told for years when to get up and when to go to bed and what to eat and when to eat it. And lastly, one of our ombudsmen was in a nursing home and noticed a resident that was wearing shorts and walking down the hallway holding a full catheter bag. And the resident gave permission to advocate, and our ombudsman walked up to a nurse, number one, to get that resident's catheter emptied in a private manner, and number two, to make sure that the proper procedures were used so that this resident had the dignity that was deserved. All of us have hot button issues, and for myself and a couple others, it's those dignity issues. And this was not anything that cost money. It just requires a little bit of compassion on the part of our ombudsman's part to make sure that this older resident had just a bit of basic human dignity restored. So that's kind of what our partnership allows us to do. We're glad to kind of be your representative to be able to help see these things done. Are there any questions or anything, folks?
Are there any questions for the Ombudsman program? I do not see your report in here, so I'm going to ask that we make sure it gets into the packet for the update.
Yeah.
Thank you so much for your time.
If any of you ever, and I had a few of you that have reached out, if we can ever be of help with one of your loved ones or one of your constituents, reach out to me, and we're glad to help out.
Thank you. We do not have any resolutions, but we get to see if Mike can do as good a job as Jenny. Do we have to put this on the floor? Right? Yeah. So do we have a motion for the review of executive session meeting minutes? Betty, and a second. Jennifer. Go for it.
It's the recommendation of the State's Attorney's Office that all previously held minutes continue to be held as the need for confidentiality still exists, and to destroy executive session audio recordings more than 2 years old, except those that relate to pending litigation.
He totally did that from memory. Please vote if you agree or disagree, I suppose. Yes, and Brian, could you vote, please? Or we lost Brian, one or the other. Okay. Brian, are you able to hear us? Can we just have him abstain in if he's not available? I believe we can just put an abstention in if we can't get his vote. And the motion carries. Do we have any public comment? We do not have public in the room, so I guess not. Any miscellaneous from our committee? We do not, so I will adjourn. Thank you guys so much.